name is Josie. I'm Chief Officer of Gate Herts, Gypsy and Traveller Empowerment. I'm here today with David from the Haemochromatosis UK. And I want to know from David, what is haemochromatosis?
Hi Josie. Haemochromatosis is a genetic condition. It's an inherited condition that leads to the body absorbing too much iron. And this iron builds up in the body and it causes all sorts of health problems because iron at high levels is actually very poisonous, it's toxic.
So David, you mentioned that it's toxic. In what way is it toxic?
Okay, well the iron builds up in the body and as I say, it causes all sorts of problems. So for example, it builds up in the liver and it poisons the liver and causes cirrhosis and even in the worst cases can go on to cause liver cancer. The iron also builds up in the heart and can cause heart problems. On top of that, it can cause joint problems, depression and mood swings, which is quite an important aspect. It can cause abdominal pain and skin discoloration, impotence in fact, and also diabetes, interestingly. So the iron, again, as I said, it's a poison, and the iron poisons the pancreas, and that can cause diabetes.
So why should travellers need to know about this? Does it affect travellers?
It does. Haemochromatosis or iron overload, it's particularly prevalent in Irish people. We know because of the genetics that it's particularly prevalent in people with Irish heritage or from Irish families. And in fact, some research indicates that as many as 1 in 5 Irish people could be carriers of haemochromatosis.
So David, 1 in 5 is quite high. What would I need to be talking to my doctor about?
You're right, 1 in 5 is very high, much higher than most of us realise how common the condition is, and in fact it has to be said much higher than many doctors realise, particularly, as I said, in Irish communities, in Irish people. I think anyone that is suffering with a combination of the symptoms that we've spoken about, the diabetes, the depression, the liver problems, the tiredness, the exhaustion, should be talking to their doctor and saying to him or her, this is something that ought to be considered because I've got an Irish background and we know that iron overload is common in Irish people.
If I was diagnosed with haemochromatosis, what would happen next? Would my family need to know? Would they need to be tested?
Yes, it is a genetic condition. So it's inherited, it's passed from one generation to the next. So usually if someone is diagnosed, their brothers and sisters should be tested. Parents and certainly children, although normally children would have to be old enough to know what was going on and to understand before they had the tests. But yes, it's something that's very, very important that all the family is aware of and that they're checked.
Gypsies and travellers find it hard at times to access services, health services. So if I was diagnosed with haemochromatosis, what's the treatment for it and how would I go about getting that treatment?
Okay, in the perfect world, the treatment is actually very simple. It's a process, it's called venesection, but what it is, it's bloodletting. So the doctors and nurses will take a pint of blood, and when they take that pint of blood, it's removing iron from the body. So it's very simple process, but it does need to be done in a clinic, and to start with, if someone has very high levels of iron in their body, it will have to be done quite frequently and for a long time. And I realise that might be difficult. I do appreciate that. That's what would happen in the perfect world. The venesection, the bloodletting, however, it does have to be done initially at least, quite frequently, and sometimes for maybe a year or two. And I recognise and acknowledge that does bring some issues, particularly for the travelling community.
So how would Gate, as an organisation, in what ways could we help you?
The most important thing is spreading awareness. So we need people in the travelling community, in the Irish travelling community in particular, to understand that it's highly likely that people in any given group are going to be affected. And we know that amongst Irish people, some of the symptoms we've described are very common. And we would encourage people to go to their GPs and ask for this testing, the testing for iron overload. Yes, well, the most important thing, Josie, is the raising awareness of haemochromatosis, of iron overload amongst your community. So I really appreciate what you're doing. And of course, we've been here today talking to a group of travellers, a focus group, and produced all this valuable information here, which we'll use to put together the leaflet. We're going to arrange some meetings with the healthcare professionals involved, and work with you hopefully at Appleby Fair as well, and draw people's attention to haemochromatosis there. So it's important that we work together.
It is, David, yeah. I'm looking forward to working with you.
Brilliant.